Good evening. This is CTV News for Tuesday, April 2nd. I'm Patricia Vallone. Thank you for joining us. Well, after spending millions of dollars and countless hours trying to come up with a fix to the state's flawed healthcare website, officials have made a decision about its future. The technology behind the online exchange will be altered. Our Denise Douglas is in Annapolis with the details.
It will take anywhere from $40 to $50 million to put in place a change that is expected to fix Maryland's healthcare exchange website. What's it going to take, you might ask? Well, the plan is to replace the technology that is being used. It will be like what's on Connecticut's healthcare exchange website, which has proven to be successful. The decision made by the Maryland Health Benefit Exchange Board comes as state officials try to get the site ready for the next enrollment period. While many legislators today praised the decision, they were still very critical about how the problems with the site have been handled.
Like many other people, I'm completely disappointed and upset with the mishandling of the healthcare exchange. It should have been done differently. We spent a lot of money we shouldn't have, and I hope it gets corrected as soon as possible. I don't know whether to have confidence or not in the change. I certainly hope it works.
Even though I'm against Obamacare in general, I think the federal site was probably a better option. I'm not really sure the reasons why we decided to spend another $50 million on top of the $150 million we really sunk down a hole. But that's the decision they made, and I'm disappointed that it wasn't given to the legislature to even comment on. They just made this decision on their own. But, you know, really, the O'Malley-Brown administration, they're the ones who are in charge of it from the beginning, and unfortunately they didn't show good leadership. They didn't come up with a good product, and now we're behind. We've wasted a lot of money, and a lot of Marylanders have been hurt who really did want to get signed up and couldn't.
The company that will be in charge of putting the new technology onto the site is called Deloitte Consulting. In a statement, Governor O'Malley says that they have chosen a partner with a proven track record to upgrade the site. He goes on to say that they're confident that this partner will have the site upgraded by the time the next open enrollment period begins in November. The upgrade is expected to take 7 months. I'm Denise Douglas in Annapolis, CTV News.
And the next open enrollment period for health insurance under the Affordable Care Act starts in November. Well, a mom who lost her child in a crash involving a distracted driver is trying to change Maryland law. She wants to toughen penalties for drivers who cause serious or fatal accidents when they're talking or texting on their cell phones. CTV's Darcy Spencer reports.
This little boy, Jake, died in a crash involving a driver who was talking on his cell phone. And now the little boy's mom is pushing for Jake's law.
We do this not for Jake. We do this because of him, because, you know, the driver was talking on his cell phone, and when he hit us at 62 miles an hour, he had not even applied his brakes.
Jake's mom, Susan Yum, says that driver got away with some traffic citations and a fine. She wants to change that. She's pushing for legislation that could land distracted drivers involved in similar crashes a misdemeanor charge. They could end up behind bars for up to 1 year.
And so what we want to do is send a message saying that, you know, this behavior is dangerous, and now there's going to be consequences.
The House and Senate have passed different versions of the bill. The House bill is stronger and applies to drivers who are texting or talking and cause a crash. But the Senate version takes out the language about talking on the phone.
You are on your phone, updating a Facebook status, texting what's for dinner, doing something that you could be doing later. If you're doing those things and you're in an accident that causes death and serious bodily injury, that we are going to be able to come after you.
Supporters say the tougher law could prevent another life from being lost to a distracted driver.
In order to stop the behavior of people texting and talking on cell phones in cars, and we all have them, you know, these make our lives easier, but they also kill people. They end lives if they're not used properly, if folks don't change their behavior and stop using them while they're driving in their cars.
Lawmakers are running out of time to get this law passed. The General Assembly session ends on Monday. In Annapolis, Darcy Spencer, CTV News.
And thank you, Darcy, for that report. Well, some Maryland workers are in hot water after a recent audit finds that they misused their state-issued credit cards. The Department of Legislative Services report shows $255,000 worth of illegitimate charges made by 4 employees. Auditors looked at transactions from 2009 to 2012 and found a number of questionable purchases. One health department worker charged more than $45,000 for various items, including guitars, watches, knives, and men's vitamins. However, work forms indicated that the purchases were for ink cartridges and software. A state spokesperson says that there are policies in place to ensure that the cards are used properly, but admits not everyone is following them. And you are watching CTV News. I'm Patricia Vallone.